All right, well, each year we commemorate World Tuberculosis TB Day on the 24th of March to raise public awareness about the devastating health, social, economic consequences of TB and to set up efforts to end the global TB epidemic. TB causes thousands of deaths every year in South Africa and the rest of the world. We're joined by Goodman Makhanda, who is a TB survivor and activist and TB health promoter with MSF in Khayelitsha, working in communities to increase TB awareness and supporting people living with TB. Goodman, thank you so very much for joining us here on SABC News this afternoon.
Hi, thank you. Good afternoon to everybody. As you introduced me, my name is Goodman Makhanda from Khayelitsha.
Yeah.
I'm an ex-TB survivor living with one lung. A health promoter, the RTP health promoter at MSF in Khayelitsha. Thank you to welcome me.
You're most welcome. Of course, you are a survivor, so there's no better person to really talk to us about TB. What were your experiences, you know, with the virus and how you believe you were able to sort of cope? I mean, you talk about the fact that you're now, you know, living with one lung. I mean, this is something that's, you know, quite serious, of course. Talk to us about your experiences.
Thank you. It was not easy. It was a long journey. When I was diagnosed with TB, it was 2013. And then when I was nearly to be finished the treatment, it's when they find out now I'm no longer with the MDR, I have the XDR. So that led to lose my lung. Yeah. But the experience, it was hard. And you must remember, I never had a TB before. But now all of a sudden I'm having the XDR, MDR TB, and then I must stop working. I must stop socializing. I must stop even mingling with people because I'm carrying this deadly disease. So the education, it was lack of education around the tuberculosis, lack of understanding too as a society, even for myself, even the doctors was around me. It was not an easy thing.
Yeah.
So the experience was hard, but I conquered it all.
Of course, you're now an activist and you're in communities and you're of course trying to be an active member of society in terms of helping those with TB. What has been the experience of those living with TB that you've interacted with, particularly around the time of you know, a pandemic? I mean, it's almost like a double whammy, having to deal with COVID-19 on one hand and then also having to deal with TB. That must have made the situation, you know, even more difficult for those that have TB currently.
Yes, you're telling the truth. It was a difficult time for us as a TB activist. Even the people they had already TB, even the people they've been TB survivors, we could say surviving because of the fear of the corona is similar with a TB. So it was not now being focused around TB. We're missing a lot of the patient. Even we have the loss to follow up for those that have been already in the treatment, but they get lost along the way because you must remember at the time of this pandemic, it was no access to the healthcare facilities. Yeah. You must come when you have appointment or they deliver the medication at home.
Yeah, and I mean, as we commemorate a TB Awareness Month, what is your message? I mean, in terms of you know, those who do have TB, in terms of seeking help. I mean, you're a survivor, so you can certainly point them in the right direction in terms of where to seek help, what to do, how to take care of themselves. I mean, as a survivor, I suppose there's different ways in which you're having to live now as compared to previously.
One thing I can say, adhere to your treatment. Believe to yourself you can make it as Goodman did it. For the TB, I like it. It's only two ways. You are infected or you are affected with a TB. The best thing is now the clock is ticking to prevent me from tuberculosis. Those who have a close contact, please go seek help at the clinic to get a prevention. Prevention is better than cure. Thank you. All
right. Goodman Makhanda, we appreciate you giving us your time and also talking to us about your own personal story. Much appreciated, sir.
Thank you.
All right. That's Goodman Makhanda, TB survivor and activist there. All right.